Hello, everyone. What if you had to visit the doctor tomorrow? Could you explain your symptoms in English? Could you tell the receptionist your name, book a time, and understand the doctor's advice? For many English learners, visiting a doctor can feel stressful, not just because of the health problem, but because of the language barrier. Today, we're going to change that and give you the tools you need. In this video, you'll learn how to make a doctor's appointment in English, how to describe your symptoms, and how to understand the doctor's questions and advice. We'll learn useful words and phrases, and I'll give you realistic role-play examples so you can hear exactly how these conversations happen in real life. Imagine this. You wake up with a terrible headache and a sore throat. You decide to call your clinic. The receptionist answers in English and asks, "What seems to be the problem?" Would you know how to reply clearly and politely? If you don't worry. By the end of this lesson, you will feel confident and ready. Here's what we'll cover. First, we'll go through phrases for making an appointment, whether by phone or in person. Then, we'll learn how to talk to the receptionist when you arrive at the clinic. After that, we'll focus on describing your symptoms in clear, simple English. This is very important because doctors need accurate information to help you. Next, I'll teach you common doctor's questions and how to answer them. We'll also practice understanding medical advice, so you'll know exactly what the doctor wants you to do after the visit. The great thing is, you don't need to memorize hundreds of medical words to be confident. With just a small set of essential phrases and practical examples, you'll be ready to communicate effectively and avoid misunderstandings. As you listen, repeat the phrases after me. This will help you practice pronunciation and remember the sentences more easily. If you can, write them down too. Writing plus speaking will make your learning faster. By the end of this lesson, you'll not only have the words you need, but also the confidence to use them naturally. So, let's get started and learn how to handle a doctor's appointment in English, step by step, from the first phone call to the end of your visit. When you need to see a doctor, the first step is usually to make an appointment. This can happen by phone, in person, or even online. In English, there are some common words and polite expressions that will help you sound clear and respectful. Let's start with some essential phrases for calling a clinic. Hello, I'd like to make an appointment with a doctor. When is the earliest available time? Do you have any appointments for tomorrow next week? I'm calling to see Dr. Smith, please. I'm available on Monday afternoon. Do you have a time then? Notice how we use polite forms like I'd like and please. In a medical setting, politeness is very important because it creates a positive interaction. Common questions you might hear from the receptionist. When you call, the receptionist may ask, "What seems to be the problem?" They want to know your reason for visiting. Is this your first visit to our clinic? Answer, "Yes, it's my first time," or "No, I've been there before." What's your date of birth? Give it clearly. July 12th, 1995. Can you spell your last name, please? Be ready to spell slowly and clearly. Do you have health insurance? If yes, say, "Yes, I do." If no, say, "No, I don't." Role-play example, phone call to make an appointment receptionist. Good morning, City Health Clinic. How can I help you? You, hello, I'd like to make an appointment with a doctor, please. Receptionist, of course, is this your first visit? You, yes, it is. Receptionist, can I have your full name and date of birth? You, my name is Ana Torres, Torres, and my date of birth is July 12th, 1995. Receptionist, thank you. What seems to be the problem? You, I've been having a bad cough and a sore throat for 3 days. Receptionist, I see. The earliest appointment is tomorrow at 10:30 a.m. Does that work? You, yes, That's perfect. Thank you very much. Receptionist, you're welcome. Please bring your ID and insurance card when you come. In-person appointment requests. If you go directly to the eye clinic, you can use similar phrases. Good morning, I'd like to make an appointment, please. Is the doctor available today? Could I see the doctor this afternoon? Example, receptionist. Good afternoon, how can I help you? You. I'd like to make an appointment with Dr. Smith, please. Receptionist. Dr. Smith is available tomorrow morning at 9:15. You. That works for me, thank you. Special situations. Sometimes you might need to explain urgency. It's urgent. I need to see a doctor today. I'm in pain. Can I come as soon as possible? This is for my child. He's feeling very sick. Example, urgent call. You. Hello, my child has a high fever. Could we see a doctor today? Receptionist. Yes, we can fit you in at 2 p.m. You. Thank you, we'll be there. Extra tips for phone calls. Speak slowly and clearly. The person on the other end can't see your face, so pronunciation matters. If you don't understand something, say, "Could you repeat that, please?" "Sorry, I didn't catch that. Could you say it again?" Write down the date, time, and doctor's name immediately to avoid forgetting. If possible, confirm details. So my appointment is on Friday at 3:15 p.m., correct? Vocabulary to remember appointment. A scheduled time to meet the doctor. Clinic. A place where you receive medical care. Receptionist. The person who answers the phone and helps you book visits. Availability. The times the doctor is free to see you. Reschedule. To change your appointment to another time. Cancellation. Telling the clinic you will not attend the appointment. Rescheduling or canceling an appointment. Sometimes you can't keep your original appointment. Here's how to say it politely. I need to reschedule my appointment. Can I change my appointment to a later date? I won't be able to make it tomorrow. Can we set another time? Example. You. Hello. I have an appointment tomorrow with Dr. Green at 11 a.m., but I need to reschedule. Receptionist. No problem. Would you like to come later this week? You. Yes. Thursday afternoon would be good. Practicing the conversation. Let's practice together. I'll be the receptionist and you'll be the patient. Pause the video and say your answers out loud. Receptionist. Good morning, Riverside Medical Center. How can I help you? Your turn. Say a phrase to ask for an appointment. Receptionist. Sure. Could I have your full name, please? Your turn. Give your name and spell it if necessary. Receptionist. And what seems to be the problem? Your turn. Explain your reason for visiting. Repeating these conversations will make you sound more confident when you actually need to book an appointment. Remember, you don't need to speak fast. Clarity is more important than speed. After making an appointment, your next step is arriving at the clinic or hospital. The first person you usually speak to is the receptionist. This is where you check in, confirm your information, and sometimes fill out forms before seeing the doctor.com greetings and check-in phrases. Here are some useful expressions for checking in at the reception desk. Good morning. I have an appointment with Dr. Smith at 10 a.m. Hello, I'm here for my 3:15 appointment. Hi, my name is John Lee. I have an appointment today. Adding a greeting like good morning or hello makes you sound polite and friendly. Questions the receptionist might ask. Receptionists may need to confirm details before you see the doctor. Can I have your full name? Answer clearly and spell your surname if necessary. Do you have an ID or insurance card? Present the card or ID. Could you please fill out this form? Take the form, read it, and fill in the requested details. Have you visited our clinic before? Yes, I have, or no, this is my first time. Could you confirm your date of birth? State it slowly and clearly. Role play example. Check in at the reception desk receptionist. Good morning, how can I help you? You. Good morning. I have an appointment with Dr. Smith at 10 a.m. Receptionist. Thank you. Can I have your full name? You. My name is Maria Gomez. Gomez. Receptionist. Do you have your ID and insurance card? You. Yes, here they are. Receptionist. Thank you. Could you fill out this form and return it to me when you're done? You. Sure, no problem. Filling. Out forms. Many clinics require patients to complete forms before their visit. These forms may ask for full name, address, phone number, emergency contact, medical history, allergies, past surgeries, current medications. Tip: if you don't understand a question, you can say, "Could you explain this question, please? I'm not sure what this means and could you help me?" Special situations: if you arrive late. I'm sorry I'm late for my appointment. Can I still see the doctor? If you need to change the time after arriving. I had an appointment at 10 a.m., but I need to reschedule. If you arrive without an appointment. I don't have an appointment. Is it possible to see the doctor today? Role play example. Arriving without an appointment, receptionist. Good afternoon, how can I help you? You. Hi, I don't have an appointment. Is it possible to see a doctor today? Receptionist. Let me check. Yes, we can fit you in at 3 p.m. You. Great, thank you very much. Cultural tip: in many countries, medical staff appreciate politeness and patience. If the clinic is busy, you might have to wait. You can ask, how long will the wait be? Will the doctor be able to see me soon? Practice dialogue. You check in. I'll be the receptionist. You answer out loud. Receptionist. Hello. Can I have your name, please? Your turn. Say your name and spell it if needed. Receptionist. Do you have your insurance card? Your turn. Answer yes or no. Receptionist. Please fill out this form with your contact details and medical history. Your turn. Answer politely. Listening and pronunciation practice. When listening to the receptionist, focus on keywords, names, times, and instructions. Example: if they say, "Please have a seat in the waiting area," the keywords are seat and waiting area, meaning you should sit down until they call you. Vocabulary to remember: check in, to register your arrival. Waiting area, the place where patients sit before seeing the doctor. Form, a document you fill out with information. Insurance card, a card showing your medical coverage. Appointment time, the scheduled time for your visit. Checking in confidently sets the tone for the rest of your doctor's visit. Once you've greeted the receptionist, provided your details, and filled out any forms, the next step is explaining your symptoms to the doctor. After you check in with the receptionist and wait for your turn, the nurse or doctor will invite you into the consultation room. This is where you explain your health problem. Speaking clearly and giving details will help the doctor understand your situation and give the right treatment. Why describing symptoms is important. Doctors can only help if they know exactly what you're experiencing. That means explaining what is wrong, where you feel it, when it started, how strong it is, what makes it better or worse. Common symptom. Vocabulary. Here are some words and phrases you can use. General illness. I feel sick. Unwell. Not well. I'm feeling weak. I feel dizzy. Pain types. I have a headache. I have stomach pain, stomach ache. I have chest pain. I have a sore throat. My back hurts. Severity. It's mild. It's moderate. It's severe. Duration. It started yesterday. I've had it for 2 days. It's been happening for a week. Other common symptoms: cough, fever, chills, nausea, vomiting, rash, shortness of breath. Useful sentence patterns. When speaking to a doctor, it's best to use short, clear sentences. Here are patterns you can use. I have plus symptom. I have a fever. I've been plus feeling. I've been coughing a lot. It started plus time. It started 3 days ago. It gets worse when I lie down. It feels like something is pressing on my chest. Role play example. Describing a cold doctor. Hello, what brings you in today? You. I've been coughing a lot and I have a sore throat. Doctor. How long have you had these symptoms? You. For about 4 days. Doctor. Do you have a fever? You. Yes, I had a fever yesterday. Role play example, stomach pain. Doctor. What seems to be the problem? You. I've been having stomach pain. Since last night. Doctor. Is the pain constant or does it come and go? You. It comes and goes. Doctor. Does anything make it better? You. Drinking warm water helps a little. How to talk about pain. Intensity. Doctors often ask, on a scale of 1 to 10, how bad is the pain? 1 to 3, mild. 4 to 6, moderate. 7 to 10, severe example. Doctor, on a scale of 1 to 10, how bad is the pain? You, about a 6. It's quite uncomfortable. Talking about location of pain to make it easier, point to the area and say, it hurts here. I have pain in my lower back. My right knee hurts. Explaining changes, sometimes symptoms change. You can say, it's getting better. It's getting worse. It's the same as before. If you don't know the English word, if you can't remember a word, describe it. I have red spots on my skin, for rash. I feel like I can't breathe well, for shortness of breath. Practice exercise. Describe your symptoms. I'll ask questions as the doctor, and you answer out loud. Doctor, what brings you in today? Your turn. Say 1 or 2 symptoms. Doctor, how long have you had this problem? Your turn. Give a time. Doctor, does anything make it better or worse? Your turn. Answer with one idea. Listening practice. Understanding the doctor's questions. Some questions you may hear. When did it start? Answer, it started on Monday. Have you taken any medicine? Answer, yes, I took some painkillers. Do you have any allergies? Answer, yes, I'm allergic to penicillin. Vocabulary to remember symptom. A physical or mental sign of illness. Pain, discomfort or hurt in the body. Fever, a high body. Temperature. Rash, red spots on the skin. Nausea, the feeling you might vomit. Dizziness, feeling like you might fall. After you've described your symptoms, the doctor will often perform a physical examination. This helps them check your body, listen to your breathing or heartbeat, and look for visible signs of illness. Common steps in a doctor's examination. Measuring vital signs. Blood pressure, heart rate, pulse, temperature, breathing rate. Example, nurse, I'm going to take your blood pressure. Please relax your arm. You. Okay, thank you. Listening to your heart and lungs. The doctor may use a stethoscope to listen. Doctor, please take a deep breath in and out. You. Breathe deeply. Checking your throat and ears. The doctor may use a light to look inside. Doctor, open your mouth and say, ah. You. Ah. Examining painful areas. Doctor, does it hurt when I press here? You. Yes, a little useful vocabulary. Stethoscope, a medical tool to listen to the heart and lungs. Blood pressure cuff, the band placed on your arm to measure blood pressure. Thermometer, measures temperature. Examination table, the table you sit or lie on. Pulse, the heartbeat rate. Questions. Doctors often ask during the exam, where exactly does it hurt? It hurts on the left side of my chest. Does it hurt when you move? Yes, it's worse when I bend over. Have you had this problem before? No, this is the first time. Are you taking any medication? Yes, I'm taking antibiotics. Role play. Example, chest pain. Examination. Doctor, where exactly does it hurt? You, on the left side of my chest. Doctor, does it get worse when you exercise? You, yes it does. Doctor, I'm going to listen to your heart. Please take a deep breath. You, breathe in and out. Role play example, earache examination. Doctor, how long have you had the ear pain? You, for 3 days. Doctor, I'll check your ear now. Please sit still. You, okay, how to answer. Honestly and clearly, doctors rely on accurate answers. So, be specific. Instead of, it hurts, say, it hurts when I walk. Give time frames, since Monday or for 2 weeks. Mention all symptoms, even small ones. Practice. Respond to the doctor. I'll be the doctor. You answer aloud. Doctor, does it hurt when I press here? Your turn. Yes or no with detail. Doctor, have you had a fever? Your turn. Answer with time if yes. Doctor, are you allergic to any medicine? Your turn. Yes or no. Special phrases to remember. It feels tender here. Pain when touching an area. It's swollen. The area is bigger than normal. It's itchy. You want to scratch it. It's numb. You can't feel it normally. Understanding the doctor's instructions. Sometimes the doctor will give short commands. Please lie down. Lie flat on the examination table. Breathe normally. Continue breathing as usual. Turn your head to the left. Move your head gently. Vocabulary to remember. Examination, a check of your body by the doctor. Diagnosis, the doctor's decision about what illness you have. Symptoms, signs of illness, tender, painful when touched. Swollen, enlarged due to injury or infection. Once the doctor has finished the examination, they'll usually explain what they think the problem might be and suggest tests or treatment. After the doctor examines you, they will usually explain what they think is wrong and what steps to take next. This part of the appointment is important because you need to fully understand your condition and the treatment plan. Common phrases doctors use for diagnosis. It looks like you have the flu. You may be experiencing an allergic reaction. I think it's a minor infection. The test results show you have high blood pressure. Talking about tests. The doctor may recommend tests to confirm the diagnosis. Blood test checks for infection or other problems. X-ray looks at bones or lungs. Ultrasound uses sound waves to see inside the body. MRI, a detailed scan of body parts. Example. Dialogue. Doctor, I'd like to order a blood test to check for infection. You. Okay, when will that be? Done. Understanding treatment plans. Doctors might prescribe medicine, tablets, capsules, syrups, or injections. Therapy, physical therapy, occupational therapy, speech therapy. Lifestyle changes, diet, exercise, sleep adjustments. Rest and home care, staying at home to recover. Example. Doctor, I'm prescribing antibiotics for 7 days. Take 1 pill twice a day. You. Should I take it before or after meals? Asking for clarification. If you don't understand something, you can say, "Could you please repeat that?" I'm not sure I understand. Could you explain? What? Does that mean, can you write that down for me? Role play example. Explaining treatment. Doctor, you have a mild ear infection. I'll give you ear drops to use twice a day for a week. You. Should I use them in the morning and evening? Doctor, yes, and try to keep your ear dry. Understanding. Medical instructions. Doctors may use words that describe how to take medicine. Once a day, 1 time per day. Twice a day, 2 times per day. Every 8 hours, 3 times per day. Before meals, on an empty stomach. After meals, after eating. Role play. Example, confirming instructions. Doctor, take 1 tablet every 8 hours. You. So that's 3 times a day, correct? Doctor. Yes, that's right. Understanding lifestyle advice. The doctor may suggest changes in your habits. Drink more water. Avoid salty foods. Get more rest. Do light exercise. Always confirm details. How much water should I drink? What types of exercise are safe for me? Practice exercise. Understanding and repeating advice. I'll say something as a doctor, and you repeat the key information. Doctor, you should avoid dairy for the next 2 weeks. Your turn. Repeat the advice. Doctor, take this medicine before breakfast every day for 5 days. Your turn. Repeat the advice. Vocabulary to remember. Diagnosis. The name of your health problem. Prescription. Written instructions for medicine. Dosage. How much medicine to take. Frequency. How often you take it. Side effects. Unwanted effects of medicine. When you fully understand the doctor's advice, you can follow the treatment plan correctly, which helps you recover faster. After the doctor examines you, they will usually explain what they think is wrong and what steps to take next. This part of the appointment is important because you need to fully understand your condition and the treatment plan. Common phrases doctors use for diagnosis. It looks like you have the flu. You may be experiencing an allergic reaction. I think it's a minor infection. The test results show you have high blood pressure. Talking about tests. The doctor may recommend tests to confirm the diagnosis. Blood test. Checks for infection or other problems. X-ray looks at bones or lungs. Ultrasound uses sound waves to see inside the body. MRI, a detailed scan of body parts. Example. Dialogue. Doctor, I'd like to order a blood test to check for infection. You. Okay, when will that be? Done. Understanding treatment plans. Doctors might prescribe medicine, tablets, capsules, syrups, or injections. Therapy, physical therapy, occupational therapy, speech therapy. Lifestyle changes, diet, exercise, sleep adjustments, rest and home care, staying at home to recover. Example. Doctor, I'm prescribing antibiotics for 7 days. Take 1 pill twice a day. You. Should I take it before or after meals? Asking for clarification. If you don't understand something, you can say, "Could you please repeat that?" I'm not sure I understand. Could you explain? What does that mean? Can you write that down for me? Role play example, explaining treatment. Doctor, you have a mild ear infection. I'll give you ear drops to use twice a day for a week. You, should I use them in the morning and evening? Doctor, yes, and try to keep your ear dry. Understanding. Medical instructions: doctors may use words that describe how to take medicine. Once a day, 1 time per day. Twice a day, 2 times per day. Every 8 hours, 3 times per day. Before meals, on an empty stomach. After meals, after eating. Role play. Example, confirming instructions. Doctor, take 1 tablet every 8 hours. You. So, that's 3 times a day, correct? Doctor. Yes, that's right. Understanding lifestyle advice. The doctor may suggest changes in your habits. Drink more water. Avoid salty foods. Get more rest. Do light exercise. Always confirm details. How much water? Should I drink? What types of exercise are safe for me? Practice exercise. Understanding and repeating advice. I'll say something as a doctor and you repeat the key information. Doctor. You should avoid dairy for the next 2 weeks. Your turn. Repeat the advice. Doctor. Take this medicine before breakfast every day for 5 days. Your turn. Repeat the advice. Vocabulary to remember: diagnosis, the name of your health problem. Prescription, written instructions. For medicine: dosage, how much medicine to take. Frequency, how often you take it. Side effects, unwanted effects of medicine. When you fully understand the doctor's advice, you can follow the treatment plan correctly, which helps you recover faster. This is where we put everything together. I'll give you a full example of a doctor's appointment in English, step by step, using the vocabulary and phrases from earlier sections. You can practice by reading the patient's lines aloud. Part 1. Calling to make an appointment. Receptionist. Good morning, City Medical Clinic. How can I help you? You. Good morning. I'd like to make an appointment to see a doctor, please. Receptionist. What seems to be the problem? You. I've been having a bad headache and sore throat for 2 days. Receptionist. I can book you for 10 a.m. tomorrow. Will that work? You. Yes, that's perfect. Yes, that's... Thank you. Part 2. Arriving at the clinic. Receptionist. Good morning. Do you have an appointment? You. Yes, for 10 a.m. with Dr. Smith. My name is Alex Lee. Receptionist. Please take a seat. The doctor will see you shortly. Part 3. Explaining. Symptoms to the doctor. Doctor. Hello, Alex. What brings you in today? You. I've had a headache and sore throat since Monday. Doctor. Any fever? You. Yes, a low fever. Doctor. Have you taken any medicine? You. Just some paracetamol. Part 4. Examination. Doctor. I'll check your temperature and blood pressure. Please relax your arm. You. Okay. Doctor. Now open your mouth and say, ah. You. Ah. Doctor. Your throat is red. I'll listen to your chest. Take a deep breath in and out. Part 5. Diagnosis and advice. Doctor. It looks like you have a throat infection. I'll prescribe antibiotics for 7 days. You. Should I take them before or after meals? Doctor. After meals. And drink plenty of warm fluids. Part 6. Ending the appointment. You. Should I come back for a follow-up? Doctor. Yes, in 1 week. You. Thank you, doctor. Part 7. At the reception. Desk receptionist. How can I help you? You. I need to book a follow-up appointment for next Wednesday morning. Receptionist. All set. See you then. Quick review. Key phrases. Making an appointment. I'd like to make an appointment with Dr. Name. Is there a time available tomorrow morning? Describing symptoms. I've had a symptom for time. It gets worse when I activity. During the examination, it hurts when you press here. I feel dizzy when I stand up. Understanding advice. So, I take this medicine 3 times a day, right? Could you please write that down? Ending the appointment. When should I come back? Do I need to book the follow-up now? Practice exercise. Your turn, I'll be the receptionist and doctor. You play the patient. Speak your answers out loud. Receptionist. Good morning. How can I help you? Your turn. Doctor. What brings you in today? Your turn. Doctor. I'm prescribing you medicine. How many times a day will you take it? Your turn. Repeat the instructions back. Final words. By practicing these steps, you can handle a doctor's appointment in English confidently, from booking it to describing symptoms, understanding advice, and arranging follow-ups. Remember, be clear and polite. Ask questions if you're unsure. Repeat key details back to confirm. Now you're ready for your next doctor's visit in English.